Hi, I'm Dr. Christopher Timms from Kirrawee Family Medical Practice. Here in Australia, we have some of the best beaches in the world, including right here in the Shire. Unfortunately, Australia also has one of the highest rates of skin cancer in the world. Now, there are many places on your body that are hard for you to check yourself, and that's why it's really helpful to have a trained doctor perform a skin check. A skin check is actually fairly simple. You'll have a chat with your GP first in the consultation room and let them know about any spots you're worried about. To remember, some people mark any they're concerned about on a sheet ahead of time or draw a line around them on their own body. Your GP will also ask you about any history of skin cancer in the family and about medications that might affect your skin. Your GP will then perform an examination. During the skin check, we will generally ask you to unrobe down to your underwear, and we will then check you from top to toe. If you would prefer to just have specific spots checked, without undressing, just let your doctor know. We look at the skin with a dermatoscope, a handheld skin surface microscope, that helps us look for asymmetry or signs of skin cancer. If there are any unusual looking spots, your GP will discuss treatment options which range from cryotherapy with dry ice, excision here at our clinic, or referral to a dermatologist if appropriate. So, what treatment options are there for skin cancer? There is a range of treatment options depending on how complex or large the lesions are. Simple lesions may be best treated with liquid nitrogen cryotherapy, also known as dry ice spray. There are several creams available to treat simple lesions, which can be discussed with your GP. Large lesions, or lesions that might be melanoma, are generally best cut out under local anaesthetic. So, what happens if you need a biopsy of a skin lesion? At Kirrawee Family Medical Practice, we're able to biopsy skin lesions in our treatment bay, with the assistance of one of our experienced nurses. Your lesion will be marked and the area sterilised to help prevent infection. Your skin will be numbed by an injection of local anaesthetic. Now, the injection can sting, but it will numb the skin up for the rest of the procedure. Your GP will remove the lesion with a scalpel or punch tool and place stitches. Stitches need to come out anywhere from 5 days after the procedure to 14 days. Your results can take between 1 to 2 weeks to be processed. Now, although we live next to some of the most beautiful beaches in the world, staying out of the surf for several days after your excision does decrease the risk of infection.